Hi everyone, I wanted to talk today a little bit about knee pain. I've been seeing a lot of knee injuries lately in the office, and I wanted to dispel some myths or some misconceptions about knees in general, right? I've been seeing a lot of what I would call like minor meniscus tears, and we can find this out by testing, we can find this out by assessment, but I see a lot of even friends and family, they'll go get an MRI when they have knee pain. They'll rush to go to an ortho and check this out. There's nothing wrong with that, but we can offer so much. So I'm trying to urge people a little bit, come get checked out by a conservative healthcare provider, because I'm seeing a lot of people go to surgery that don't actually need it. So one of the big myths is that if you have a meniscus tear, you need surgery. And that's just not true. We have several different types of meniscus tears, and only a couple of them actually need the surgery. If it's impacting your range of motion and like the little fibers, so the meniscus is the cartilage lining. The meniscus is the little cartilage lining on top of the knee. And when you move the knee, if that cartilage lining gets trapped and caught, it will create like a pinching, locking sensation. Sometimes if we're not able to release that, that may need to go get surgery to be cleaned up. But for the most part, when we do our assessment, we can tell if it needs surgery or not. Most of them respond almost automatically to movement and treatment, right? So one of the big things we'll do is we'll move it. And if people say, actually, it feels better when you do that, I know they don't need surgery. Okay, so it's a really, really cool way of checking out knees and making sure that people really don't need to go as drastic as a surgical intervention right away. So that's one of the big myths on meniscus tears, is they're really not always that serious. I've had CrossFitters squat double their body weight 2 weeks after having a meniscus tear. So it can get better quickly, and it will. Another big one that I've seen is Osgood-Schlatters. Osgood-Schlatters is a condition that affects adolescents, especially boys. What happens is it is growing way too quickly for the bones are growing way too quickly for the tendons and the muscles to allow for. So what happens is the little top of your tibia, which is your shin bone, it pulls, and when it pulls, it rips a little bit of the bone off. It's really painful. It hurts for our teens and our kids to run around and practice on these, but it is not a limiting thing. It's not something to stop them from their activity. So obviously, if it's so painful they can't do it, yeah, we need more intervention. However, with some dry needling, taping, and training, a lot of these things improve. So what do we do when we have an injury? One of the biggest things I see, especially like people are worried about ACL, MCL tears, we need to make sure we're focusing on training the glutes. If we train the hip and we train the ankle and foot, we take a lot of pressure off our knee. The knee is a hinge joint. And if it gets stuck in between those two areas, the ankle and the hip, it can drive a lot of force into that knee that's not necessary. So one of the big things we always check for in our athletes, and this is something you can look out for at home or at practice, do we have good ankle mobility? If yes, then we have a better chance of that knee being healthy. Do we have good hip mobility and hip strength? If that's true, then yes, we have a better chance at avoiding the injury. So all of these factors go into how we treat knee pain, how we look at it, and typically we can get your athletes better without having surgery or any other intense imaging or anything like that.